Another key activity of Accelerate is organizing the Pediatric Strategy Forums. These forums are meetings in which we gather multi-stakeholder experts to recommend solutions to critical questions in pediatric oncology drug development. So, same as in the research group activities, we focus on a dedicated specific hot topics, and we invite the best experts about that topic. And we sit them together at the table in a usually 2-day or 3-day meeting to discuss the topic and come up with solutions. These meetings are per invitation only and include, same as in all Accelerate activities, the representation from all drug development actors. So we invite academic experts, pharma companies that are developing drugs of interest for that topic, regulators such as FDA and EMA representatives, and of course, patient advocates. These forums are usually held twice a year, once in the US and once in the EU alternatively. Due to the COVID situation, the forums for these years have been organized virtually. So to give you a better understanding of how these forums work, I will show you the example of the ALK inhibitors forum. In fact, we organized an update meeting to the first PSF ever, which was about this, recently in January this year. So a bit of background, you have to understand how ALK inhibitors started to be developed and why they become so crucial in pediatric oncology. As you may know, ALK was discovered as a target and playing a key role in cancer back in '94. Already then, it was evident that it played a role not only in adult cancer, concretely in lung cancer, but also in tumors that are of interest in children, like anaplastic large cell lymphoma or inflammatory myofibroblastic tumor, and of course in neuroblastoma. In spite of this, the development of ALK inhibitors was totally focused on lung cancer, in the adult tumors. And some years later, in 2011 and in the US, and in 2012 in Europe, it got, the first ALK inhibitor got marketing authorization, crizotinib, for lung cancer. Unfortunately, even though it was already clear that this target could be of interest for children and adolescents, this drug received a waivered pediatric development with the argument that lung cancer does not occur in children. And this is one of the reasons under the PRIA regulation in the US and the European still current regulation to get a waiver for a compound. In spite of this, the pediatric oncology academic community worked for the next decade in investigating ALK inhibitors in children and adolescents. And in fact, thanks to that, this year, crizotinib received marketing authorization by the FDA in anaplastic large cell lymphoma. And there are currently approved PIPs for ALCL and IMT in Europe as well. So, as you see, there has been a delay of 10 years between the first marketing authorization for adults and the authorization for children and adolescents. And the academic community had to step in to investigate this compound in children and adolescents. So we have to work on avoiding this scenario where scientifically and medically unjustified waivers are delivered. This is just to show you how complex this landscape can be, and we are just talking about one specific group of compounds, the ALK inhibitors. So not only this, but another problem is that well, or another opportunity, depending on how you see it, is that many ALK inhibitors have started to be developed for adults in the recent years. So the landscape is really complex, and that's why a first Pediatric Strategy Forum was organized already several years ago, and recently this year we had an update meeting. And I want to show you a clip or some clips, some short clips of this update Pediatric Strategy Forum on ALK inhibitors, so you get an idea of what is discussed there. You will see Professor Andy Pearson presenting the ALK inhibitors landscape and discussing the main issues that need to be solved for children and adolescents with cancer.
As we understand, demonstrates the current position as of today, with yellow blocks being completed or ongoing studies, and those in green planned or studies. And we have 3 PIPs which are publicly available. So there has, without question, been some movement in the ALK landscape over the last 3 to almost 4 years. Very much the overall conclusion is, I mean, without question, there was single agent activity in anaplastic large cell lymphoma, IMT, and neuroblastoma, which was in 2017. We need more data on the activity in CNS fusion tumors, and Amar and Francois beautifully presented that. We, I think, have repeatedly during the meeting highlighted that acute toxicity is an important element of the decision-making process. So I think the challenges now, we feel, are how to combine these products with therapeutic agents and how to establish their role in standard of care therapies. And that means a partnership between academia, lung trials, and industry.
So as you see, this is just an example of how complex, but also how relevant these pediatric strategy forums are. And here you have an overview of all the pediatric strategy forums that have been organized so far. The first one, as I mentioned, was the one on ALK inhibitors back in 2017, and with the recent update this year. But there have been other also very crucial strategy forums, such as on mature B-cell malignancies, on checkpoint inhibitors, on AML, which already had an update meeting itself, and also on epigenetic modifiers, which also had an update meeting in July last year. For this year, we have an upcoming meeting on CAR T cells in May, and at the end of the year, we will have a dedicated forum on sarcoma. So as you see, these are really, really hot topics that are very complex and that really benefit from multi-stakeholder actors sitting together and discussing concrete solutions. And for each forum, a manuscript is published with all the information and the conclusions being made publicly available.